You're listening to The Foundation of Wellness, a refreshing take on diet and lifestyle. Join me, Marisa Moon, as we tackle modern health with innovative and ancient principles. I'm a certified primal health coach and intermittent fasting instructor at marisamoon.com. Well, hey, and welcome to the show. It's me, Marisa Moon, your host, and thanks for tuning in because I know these are unordinary times and you may not be commuting as much as often, so it's really cool if you're listening from home. I absolutely love that. Now, on today's show, we're asking Dr. Bob Newhaven to explain to us his experience so far using telehealth in his Northwest Indiana wellness center called Motus Integrative Health. Eric and I have both collaborated with him at Motus Integrative Health, and we know he has so much to offer, and it's great to have him here. He explains to us a couple of patients that he was able to help so far in virtual appointments, aka telehealth appointments. And he also gets into some tips about how we can find the right chiropractor near wherever we live. First, I want to explain what is telehealth. It's technology-enabled health management and delivery systems that extend our access to healthcare services. It's basically virtual or technology-enabled healthcare, and it's even mobile healthcare. Telehealth has advanced from this intimidating form of clinical communication to a mainstay now in the way that providers and patients are interacting. It's gone from being a side feature of the healthcare system to an expectation almost, especially now with the social distancing laws in place. Is telehealth safe? Yes. According to the American Telemed Organization, data from a 2018 survey from healthcare providers by Deloitte found that telehealth can improve patient experience, which is an important factor in the quality of care. In fact, 9 out of 10 physicians, 90% of them, see the benefits of virtual care, especially regarding your patient's experience, access to care, patient satisfaction, and improved communication with the care team being those main benefits. Now, while there's no common definition of telehealth and all of the synonyms that have been created to go along with it, the term telehealth itself can evoke a limited view of what it really does. What was until recently referred to as telemedicine now encompasses a much broader just range of services and technologies like artificial intelligence or AI, and virtual reality and behavioral economics are a few examples that come to mind that broaden this field, and they're transforming the way that health and care are being delivered. Dr. Joe Kavar, the president-elect of ATA, the American Telemed Organization, says as telehealth becomes an important solution for flattening the curve of the coronavirus, the ATA and our members are well positioned to deliver on the promise of virtual care technologies. Studies have consistently shown that the quality of healthcare services delivered with telehealth are as good as those given in traditional in-person consultations. Isn't that cool? In some specialties, particularly like mental health or the ICU care, telehealth delivers a superior product with greater outcomes and consumer satisfaction. So this is starting to sound good all around. The greatest impact of telehealth is on the consumer and their family, the community. Using telehealth technologies reduces the travel time and related stress for the consumer, especially at this time. And over the past 15 years, ATA says that multiple studies have documented consumer satisfaction and support for these telehealth services. And such services offer the consumers the best access to providers that might not be available otherwise, and so many more services without the need to travel those long distances. Now, telehealth and telemedicine are slightly different technically, but really they can be used interchangeably and are already being used that way, so just don't worry about the difference. Now, I'm happy to bring Dr. Bob on the show today to take us into the world of his chiropractic wellness center at the time of this pandemic, and we can learn the ways he's helping his patients via virtual appointments. And now for a little background on him before we go into the interview. Dr. Robert Newhaven, or Dr. Bob as we like to call him, is a 2010 graduate of National University of Health Sciences, NUHS, and while he was there, he received extensive training in areas of diagnosis, adjustive technique, rehabilitation, gait analysis, soft tissue therapy, kinesio taping, nutrition, and acupuncture. Now, after graduating, his postgraduate coursework continued in all different areas. Ready for this? Biomechanics, palpation, McKenzie therapy, functional rehab, dynamic neuromuscular stabilization, known as DNS, active release technique, or ART, global rehabilitation and injury prevention, GRIP, GRIP, pediatric rehabilitation, and I'm not even going to try this one, temporomandibular dysfunction. Okay, I tried it, and I did it. TMJ and TMD, and various other areas. Dr. Newhaven has completed over 1,000 hours of postgraduate coursework outside of his chiropractic education, and he's also a Department of Transportation certified medical examiner. Dr. Bob chooses to live a healthy lifestyle in and out of the office. He's gluten-free due to its many health benefits, and he's a member of the Paleo Physicians Network. It's wonderful to have him here. Let's get into the interview now. Welcome to the show, Dr. Bob. This is cool having you here. I've actually thought about it for a long time.
Yeah, well, thanks for having me, Marisa. Glad to be here.
Yes, and Eric, my husband, was in full support. He was like, oh, he'd be a great guest. He sure loves everything that he does, and he's passionate about sharing it. So,
yeah, well, thank you. And it's definitely what I do is who I am, and so I think when you find something that you're passionate about and you love, it doesn't really seem like work.
That's awesome. Even now, I mean, it's April, 19th? I mean, April 21st. It's like, how are you handling all of these changes?
It's definitely been a roller coaster. But for me, I look at each day like a new puzzle to solve. And so it's really how the approach that I take to healthcare, but it's also the approach that I take to business as well. And so, obviously this time has thrown curveballs at everybody out there. And back in the day when I played baseball, I could hit a few curveballs. And so that's the approach I'm taking now is, trying to find solutions to the challenges ahead of me and not just sitting thinking about, okay, well, now what? Like Eeyore. I'm not an Eeyore kind of person. So we're just going to, do what we can do to move forward.
Oh, that's so cool. You're adaptable, something I really admire in other people and want to do more of myself. Well, is Modus Open? Modus is your integrative practice, and it's a space I've been to. It's absolutely beautiful in Northwest Indiana. Is it open right now as of April 21st, 2020?
Yes, we are open. My company, Motus Integrative Health, we have 2 locations in Cherville and Crown Point, Indiana. We are open for business. We have some limited hours. Some of our doctors are also limiting their hours, but yeah, we're open. We're also doing telehealth visits, which are essentially like FaceTime visits. So I think most people know what Skype and FaceTime is. Doctors can do that kind of thing too. And most people, some people want face-to-face, but depending on what your issue is, even people like myself, like a chiropractor and physical therapist, there's a lot that we can get done with a video session.
That's really interesting. And that's kind of where things are headed right now. If you want to limit your social interactions with patients right now in this circumstance, you kind of had to consider telehealth. Were you doing telehealth before the coronavirus pandemic?
We were not doing telehealth. It's something I've been looking into for the last year or so, but I just hadn't pulled the trigger on it because for us it wasn't a necessity. And it quickly became one.
Yeah.
So we hopped on and, I've done some telehealth visits and they've all gone really, really well. I look at it, you can't understate the power of touching another human being. So it doesn't replace that. But for the right person with the right cases, doing a telehealth visit is really about empowering an individual for me to take care of themselves and to teach them about their condition and what they can do about it themselves at home today.
That's great. I love that you are really caring about that because that's what most of us want from our practitioners. We're like, okay, how can I keep this up without you? Or how can I make this better between visits? So that's really cool. Why don't you tell me and the listeners what Motus Integrative Health usually offers, like what you usually do with your patients there, and then which of those treatments have transferred over to telehealth?
Sure. So we're an integrative center. So we have medical care. We have a nurse practitioner who does natural medicine. We have chiropractic services, which we're still offering as well. So we're offering stuff in office, adjustments, rehab. We do a lot of mechanical evaluations and just really looking at the way they function and why they have pain, not just what the source of the pain is, but why it's happened in the first place. And that's definitely something that has allowed us to continue to function both in office and with telehealth. We also offer some acupuncture, some dry needling. So that's stuff obviously we can't do over telehealth, but we're doing in office. And we were offering massage therapy, but that's one of the services that currently due to the pandemic we can't offer, which is okay. And so we're still offering our medical services, our natural medical stuff via in office and telehealth, and the chiropractic stuff as well, and the rehab.
That's awesome. And can I just say that I wish massage was considered essential? Like, how many of us need a freaking massage right now?
I think a lot of people do, myself included.
I'd pay double for that right now.
Yeah, and my personal opinion is it's something, especially if you just get work done face down, it can, in my opinion, it can be done really safely. But, I completely understand why they made it that as well. So, for those of you who are wishing you could get massage right now, you are not alone.
Well, Dr. Bob, I'd love for you to tell us some specific cases that you've been able to handle with telehealth. But first, why don't you walk us through what it's like for a patient using telehealth for the first time? Do I have to download like new software? Do I have to learn anything new before I really have access?
Sure. So right now, the government has actually allowed non-HIPAA compliant software to be used for telehealth because of the pandemic. And so we are using Zoom for our telehealth visits. Zoom is an app that you can download on your phone, you can download on your computer, very similar to Skype. Some people probably could use FaceTime right now, but we're using Zoom because it's easy at work. So so if somebody were to call in and want to schedule a telehealth visit with us, we put them on the schedule for anywhere from 30 to 60 minutes. We send them a link with the Zoom meeting, and then if they don't have Zoom, they download it. And when it's time to do the call, they just log in, and there we are, face to face.
All right. Yeah, that's actually pretty easy. And I know I've sent Zoom links to clients who've never used Zoom before, and it's so simple. You even can use the browser, I think, too.
Yeah, you can.
Yeah. Mm-hmm. Okay, cool. So that sounds totally doable. And you made it sound like you give the patient the option so they can come in or do telehealth. You're not really navigating and telling them what to do.
Yeah. So if somebody is not comfortable coming in, we're definitely allowing them to do telehealth, or they think, that's something they want to try. Great. For our natural medical stuff, most of that stuff can be done via telehealth as well. So we're giving patients the option, but also, if we think it can be handled via telehealth, we're encouraging that.
Oh yeah, totally. Yeah. Are you familiar with any of your peers or colleagues who have actually closed their physical location in the meantime and only doing telehealth?
Not so much in like chiropractic and physical therapy, but I know some medical providers that are primarily doing that.
Wow. Okay. Yeah, lots to learn there. Well, tell us who you've been able to help and what that experience has been like so far.
Yeah, so I have one particular case of somebody who had shoulder impingement. So he was having shoulder pain that was caused by, he was lifting a lot and sitting more often than usual. And what can happen with a shoulder impingement is some of the muscles can become pinched under the joint in the shoulder. And, I was able to take a history with him and make sure there was nothing, sinister or more serious going on. I was able to do a visual exam. I can look at his eyes and his, mouth. I can check his range of motion with his neck and his shoulders. And then with us in particular, I was able to have him do some functional movements, is watch him do a push-up, and watch him lift some weights and just pay attention to what's happening. And so for what we do, we're looking at the quality of the movement, not just the movement itself. And I think a lot of things can be seen in the quality. And so he was lacking quality in some areas. And so we were able to do some essentially problem solving, as I had him try a bunch of different exercises that I thought would help him. And we figured out some that we thought were good and some that he should stay away from. And then he is married, and so I taught his wife also how to do some hands-on muscle work on an area that I thought needed it done. So
that is cool.
Yeah, so instead of, having my hands, he had his wife's hands, and I coached her through it a little bit, and it was something, pretty simple. It was just some stretching and some muscle work, something that she was definitely capable of learning. And, by the end of the phone call, he was about 90% improved with his range of motion and his pain.
Really?
Yeah.
Whoa. So the effects of those types of treatments can be immediate?
Yeah, depending on the problem. So in my opinion, his problem was just not being in a good position. So by changing his position during certain movements, like raising his hands overhead, we were able to change the pain.
Oh my gosh, that's really cool. Why don't you tell us some symptoms of muscle impingement or shoulder impingement?
So his symptoms, for example, when he would raise his arms up over his head, like he was reaching for a light bulb over his head, he would get a sharp pinpoint pain at the top outside edge of his shoulder. And same thing if he were raising his hands out to the side, like he was going to do a jumping jack and clap his hands over his head. He had a range of about 45 to 145 degrees. So kind of in the middle, like if you were flapping your arms like a bird, that he was having that same pinpoint pain. And so those are pretty classic symptoms of a shoulder impingement, is pinpoint pain, but not during a whole range, during just parts of a range of motion.
Okay.
And then he was having pain also during push-ups, and anytime he would press a weight over his head, he was having pain.
Yeah, I can relate. I get these micro tears in my shoulder all the time, and it definitely gets in the way of my workouts because, you might be really in the mood and feeling good, and then all of a sudden you realize you can't do something simple like overhead or doing a push-up.
Yeah, and so with him, for instance, he couldn't do a push-up without pain on the ground, so we elevated him to the wall. And then I modified his elbow position, and with a change in elbow position and an elevated push-up, he was able to do them without pain.
Good.
So a really simple progression for him is to slowly work his way back down to the ground.
I love that.
So we take the exercise that causes pain and find a way to adapt it and modify it to where it's not painful anymore.
Yeah, that makes a lot of sense. What type of interactions or services like this are actually covered by insurance in your practice? And then do they still get covered by insurance with telehealth?
Yes. So telehealth essentially covers the same as what we would do in office.
Great.
Yeah. So, and the government has also, and insurance companies have allowed more to be covered with telehealth as well nowadays because of the pandemic. But yeah, so, in our office, we take most insurances. So you'd come in for an initial exam, typically covered by your insurance, unless you have a deductible or copay, which is a pretty standard part of that. And then pretty much all the services we offer are as well. Okay. Except for, a few things. Some insurances cover acupuncture, some do not.
Yeah.
But yeah, most of this stuff as well is covered with telehealth.
That's great. I don't know why. I thought most things at a chiropractor are not covered unless you already tried getting care from your primary physician and they send you to a chiropractor.
Yeah, no. So in every state that I know of, chiropractors have direct access, just like you would go to your primary care doctor. You could walk right in our office and we could evaluate and treat you without a referral. Some insurances, like HMOs, where you have a primary care doctor at the top of the pyramid, they have to send you out. And so some require a referral from your primary care, but the vast majority, people can walk right in our office and get care.
That's pretty sweet, because there's so much that you do that just the biomechanics of our body are just so widely misunderstood or overlooked, and you can bring people so much more ease and peace into their daily life if they really can discover what is causing their pain or limiting their movements.
Yeah, and I look at one of the things that we do well is we work on mechanical pain. So chemical pain is a little bit different. That would be, more like an inflammatory based pain in somebody like rheumatoid arthritis. It's not that we can't have effects on that, but things like chemical pain are treated well medically. So, an example, I had a gentleman walk in this morning in an emergency. He couldn't stand up straight. He was bent over.
Okay.
And what he had a disc herniation that was mechanically pushing on a nerve. So imagine if you took your finger and squeezed it. That is what I would call a mechanical force on your finger.
Mm-hmm. So
if after a while, if you do this enough, your finger is going to start to hurt and the feeling's going to change. So if I inject a steroid or if I put lidocaine on your finger, what's still happening?
You didn't get rid of the thing that caused the problem to begin with.
The pinching. I'm still pinching your finger.
Uh-huh.
And so this is a lot of times, for instance, why opioids don't work for back pain. Oh. And, there's some new literature coming out that, people who see a chiropractor are 60% less likely to use opioids during their life.
Whoa.
And so, and a big part of that is because we work on mechanical pain and really changing that finger, pinching the other finger, or changing the disc hitting the nerve, if you will.
Yeah.
And so through different movements and exercises and things like that. And so yeah.
Oh, cool. Yeah, that's really inspiring too, and hopeful. I think a lot of people with back pain need that kind of hope. So I hope this message reaches whoever needs it. Maybe they've never even been to a chiropractor because they're afraid. I mean, let's think of something they might imagine it being like. All you hear about is adjustments. Like they're going to lie on the table and they're going to crack you in a couple of ways and then you're out the door. What's it like? Is that really what it's like?
No, yeah. I'm not going to Chuck Norris or Arnold Schwarzenegger somebody's neck for sure. Adjusting is a tool. Just like exercise is a tool, just like acupuncture is a tool, just like injections are a tool, just like medications are a tool. And a good provider, whether it's a physical therapist, a chiropractor, or a medical doctor, our job is to, in my opinion, apply the best tool for the job at any given time. And so many people that come in here don't necessarily need an adjustment, so we don't necessarily adjust them. Maybe we do. The gentleman that came in today with what I believe to be a disc herniation, I did adjust him, which for me, it's just creating a little bit of motion in a joint that's stiff. So for instance, if you jam a finger, it feels very stiff, right? Mm-hmm. So what do you do to make that feel better? You start to move it. Right? Motion is lotion. And so sometimes when things we're stiff or stuck, sometimes people need help making them loose again.
Oh, yeah.
So it's not that bones are out of place or anything like that. It's just that things get stiff maybe because you sit all day or you fell or something like that. And so that's an example when an adjustment would be a good tool. This gentleman today needed exercise as his primary tool. And so we used specific exercise to try and influence the disc, so the disc herniation that I think he had, to move off of the nerve that it was hitting.
Yeah, that sounds like quite a relief.
Yeah, he's definitely still in some pain, but he walked in barely not able to stand upright and left being able to stand upright. So that was definitely some progress, and he is going to need some more help, but we started to change that mechanical thing pushing on the other thing. And, and that's what we're able to do today.
Wow, that's really cool. I'm wondering if you have some tips to give our listeners about finding the right chiropractor. What kind of things should you be looking for when you see a chiropractor's website or you see his bio? Are there certain things that tell you maybe someone's better for what you need or not?
Yeah, so one thing that we list on our website is we list all the courses that we've taken so that people see, we're not just doing the bare minimum to help them. Is we're going above and beyond, and we're continually taking courses to learn more
Yeah.
and more and get more and more tools and acquire more knowledge to help people. And so, that's not all chiropractors or physical therapists or doctors list that, but if they do, that's definitely a good sign is they want you to know that they're continually learning to get better. And so same thing with certifications. A lot of people will list their certifications. If a guy's got a lot of letters behind his name, he has gone above and beyond to learn more to be able to help people. So that's not just somebody doing the bare minimum.
Oh, yeah.
So those are, definitely good places to start. And, I would say some other things are, looking for people like us, for instance, that offer additional services. Is somebody who wants to offer more tools may offer more services like acupuncture, natural medicine, massage therapy, because again, different people respond to different things.
Mm-hmm.
And so those are some pretty simple things that you can look for on anybody's website.
Yeah, those are good tips. Let's take it back to telehealth before we start wrapping up this episode, because I'm wondering if there's anyone else that you helped with telehealth that you'd like to tell us about, or what you're excited to do with patients moving forward with telehealth.
Yeah, so I have a young girl that I'm working with who she cannot walk yet. And so what we're working on with her is teaching her parents some different exercises at home to continue making progress towards her ability to be able to walk. And so she has like a genetic syndrome that doesn't allow her to do that. So, similar to like a cerebral palsy, like somebody might know, but a little bit different. And so I was able to just show her parents some ways to continue to help progress her at home. So a little different even than pain is, there's a lot of ways to move forward. So whether you're in pain or you're stuck somewhere with, where you're at physically, or even from an athletic performance perspective, these are all things that, people with our training, mine in particular, can take a look at and start to assess from home. So whether you're, just somebody who's a desk worker or an elite level athlete like a sponsored powerlifter, is, we can evaluate and give you suggestions and ideas and take you through different things via telehealth if need be.
That's cool. I never even would have thought of that.
Yeah.
I can't wait to see where the innovations are going. And I think I'm going to have you back, Dr. Bob, because before this pandemic started, we were going to talk about all of the really cool chemical, mold, heavy metal testing that you do, because I think it really opens up a whole world of possibilities of finding the root cause of some people's symptoms and discomfort. So I know you have a lot to share there. And what do you think about coming back on?
Yeah, sure. Lots to talk about. So I'm happy to do it.
Okay, cool. And if people listening wanted to find you in one way or another, what's the best way to do that?
Yeah, you can go on our website. It's Motus, MOTUS, integrativehealth.com. And you can also email me at Dr. Bob, DRBOB, at modusintegrativehealth.com. And I'm happy to field any questions or comments or concerns, or even just, one thing we do a lot is people ask me, hey, I'm moving to this area, or I have a friend in this area. Can you help me find a good provider in that area? And I'm happy to do that, because sometimes people don't know where to look. And, if you find a good provider, they will empower you and help you to be better, whether they're the one treating you or not, in my opinion.
Oh, absolutely. What a great resource you are. That's so generous of you. And I think that you might get an email or two. So
Sure.
Now that you offered it.
Bring it on.
Okay. Thanks so much, Dr. Bob. I hope you and your family stay safe and happy. And it really is a pleasure.
Thanks. Same to you.
Bye.
Bye.
Well, that about does it. Thanks so much for joining me on the Foundation of Wellness podcast. If you found this useful, please, as usual, share this with another person who may not listen to podcasts yet. How helpful would that be for you to open up their world to the magic of podcasts and to help support this show so I can keep making awesome episodes for you? Reach out to me on Instagram at Marisa_Moon_. If you have a great guest you want to introduce me to, that would be fun. Or if you have any show ideas or you just want to talk to me about health coaching, about life, about this show, I'd love to get to know you better. You can also join me in our Facebook group, the Foundation of Wellness, Refreshing and Diet and Lifestyle Chat. That's at facebook.com/groups/FOW podcast. Talk to you soon. Bye.